portion of the Arizona Daily Mix is sponsored by Aging and Awesome.
Seniors on a fixed income are being stretched, having to make every dollar count, but there are some government programs that can help when it comes to prescription drug coverage. Insurance expert Kai Sisson is here to help. Thank you so much for being here.
Thank you, Teresa. Love the Daily Mix.
Thank you.
It's a great time.
Thank you so much. I know, it's all bright and cheery.
I know, it makes you happy.
It makes, and now I'm going to make everybody sad.
No.
Okay, because I'm going to, well, the reality is, you know, my dad, for example, is 81, and he's on a fixed income, and there are times when he doesn't want to get his medication because he doesn't want to have to pay, and I know that you have a lot of methods for helping seniors.
Yeah, that's what I do every day is help people first evaluate how much money are you making, how much money on your Social Security do you have, assets, and basically put it into a calculator. It comes out and says, well, this person is eligible for what they call extra help through the Social Security Administration. A lot of people don't even know that they have this option to get this extra help.
That's so interesting. They have no idea that they're eligible for these programs.
Right. It's a Social Security subsidy. It's a federal subsidy. It caps your drug costs at a very low cost. It changes every year, so 2025 is going to have a new threshold, but 2024 it was $11 per month per prescription.
Wait a second. If you exceed $11?
No, certain drugs are capped at $11.
Okay.
So a drug that could cost $1,000 to someone not on drug subsidy.
In other words, you need metformin, you need a statin, whatever it is, a cancer drug.
Something.
It cannot cost more than $11.
Cancer drugs are Part B. So sorry, there's all these. I'm talking about Part D. Yeah, there's all the caveats, but to keep it simple here, Teresa, yes, there are as a program that I help people apply for. It's a very simple application. Sometimes people get an application from Social Security directly in their mail, but you know how the mail is. They could lose it. They look at it,
and you just
not
think
me.
It's junk mail. You're like, oh, it's from the government. This can't be helpful.
Exactly. So I don't work for the government, but it is. I am a local person here in Arizona to take your call, ask you the right questions, see if it's something you can get. And if you are spending a lot of money on your prescription drugs, that's one way. There's also, of course, Arizona Access. When you have Medicare, Medicaid, those two working together to make drugs extremely affordable, very, very low cost. But again, it really starts with that phone call. Kai, am I able to get extra help through Social Security? And then I go from there. I go, okay, well, let's see if you're eligible for Arizona Access. If you don't know what that is, it's Medicaid. Arizona just calls it Access. So there's all these different ways, because once you get those two qualifications, or one or the other, then if you are a Medicare beneficiary, you then have a whole nother slew of options for plans with lower copays, food cards, all these different things that you didn't know you could have, all based on your income and assets, which, yes, there's certain thresholds that some might not make, but I can help evaluate if you can.
Lower copays.
That's something too, yeah.
Well, we know there are caveats, right? So cancer drugs are excluded, and I don't know if you'll have the answer.
They're not excluded, they're covered, but it's not what I'm talking about right now.
Yes.
But it's a whole nother.
It's a whole
it's very
complicated lane.
Yes.
But in general, what sorts of chronic conditions that are expensive are you helping with?
Diabetes. So people have certain diabetes drugs, whether it's an insulin, and you've been seeing the commercials from politicians. We got drugs, insulins to $35. It's so fun when you hear a politician give a blanket statement. Just know it's not that simple. Certain plans are allowed to have certain types of insulin on their plan. So Plan A might have the insulin you have, but Plan B is not $35. You need Plan A that has the insulin at $35 on their list. Side note, okay, I digress. Back to what I was talking about. When you have certain chronic conditions, diabetes, COPD is big, any really heart and lung issue, what these plans consider chronic, you then qualify for certain plans that might have different copays if you have those chronic conditions.
I cannot thank you enough. This is going to be so helpful. I just know this is going to be helpful for people because it is very, very confusing.
I know.
And Kai, you are a very helpful go-between that helps seniors to understand what kinds of programs they're eligible for. And if you would like to reach Kai, of course, we have his number on the screen, or you can check out our website at cw7az.com. Thank you so much.
Thank you, Teresa.
The preceding portion of the Arizona Daily Mix was sponsored by Aging and Awesome.